Hello. Welcome to Crisis Response in a Pandemic, Connecting Immigrants and Community. During this presentation, we ask that you save questions for the end of the session. I'm Ariel Burgess, and with my colleagues, Chelsea Hand-Sheridan, Anita Barker, and Rosie Lang, we will discuss COVID-related challenges faced by the International Institute of St. Louis and how we attempted to address these challenges in a rapidly and almost daily changing environment. I'm sorry, hold on, I'm trying to forward the presentation. And are you seeing the first, the introductory slide? Are you seeing COVID-related challenges? No. Hold on a minute, I apologize. Okay, I'm going to continue to move on. I'm not quite sure why you can't see my screen. I'm going to move on. Some of the challenges that the International Institute faced that we will discuss include how to provide remote services with staff working from home in response to the orders to shelter in place, helping clients apply for unemployment benefits, and getting vital information to a client population with limited English proficiency and limited knowledge and access to technology. Like others, with almost no warning, we had to act quickly to protect both clients and staff while navigating novel ways to provide services and address needs. We quickly began collecting translated CDC COVID materials and getting the information to clients both written and in verbal form. Simultaneously, two key working groups were commenced to address COVID-related agency and client needs. The COVID response team developed and updated agency policy and procedures related to COVID, such as occupancy room limits and signage. And the return to work team developed procedures and schedules for the agency to reopen based on the city's COVID testing and positivity rates. For staff to work remotely, both teams worked with our IT department to determine and resolve issues needed to work from home. Did staff have equipment? Did staff have the programs needed so that we could effectively provide services to clients in this new environment? On March 18th, the city issued a shelter-in-place order. Coincidentally, and maybe ironically, while residents were told to stay at home, March 2020 saw the largest number of refugees arriving to St. Louis in a given month. The first 3 weeks of March through March 19th, 38 Congolese and 11 Afghan new refugees came to St. Louis. These refugees came right before, during, and even one day after the shelter-in-place order. Thank you, whoever got the screen going, thank you very much. Even with shelter-in-place orders, resettlement services continued. We went to the airport and welcomed new arrivals. We found housing. We scheduled health screenings and Social Security applications per those agency guidelines and schedules. We enrolled in eligible benefits and remotely provided various cultural orientation to the refugees' new homes and city. During a pandemic, daily contact and communication was more necessary than before. Not only were these new arrivals coming to a place that they were unfamiliar with, they also arrived to an environment that was shuttered and closed and even more unfamiliar than they could have ever imagined. Institute staff were the only link to new arrivals for everything from life to St. Louis to all COVID information. A quick assessment of March arrivals found that all new arrivals had at least one cell phone per family. However, most of the families did not know how to maximize the use of these cell phones. They had no knowledge of how to use voicemail or any remote platforms such as Zoom or even WhatsApp. Using telephonic and video calls, we taught the March arrivals how to download and use Zoom so that daily communication and services could be provided. This required multiple and repeated step-by-step demonstrations, done of course remotely and in native language. Additionally, for the immigrant community at large, we hosted 2 free COVID testing events with Affinia Healthcare. At each event, 200 people were tested. And in October, Walgreens provided free flu shots to 120 Institute's clients and staff. I now turn it over to Chelsea Hand-Sheridan, who will address some of the employment-related concerns that we faced.
All right, thank you, Ariel. As Ariel mentioned, my name is Chelsea Hand-Sheridan, and I direct the Workforce Solutions team at the International Institute of St. Louis. So today we'll be discussing some of the unemployment challenges that are faced. So as you are all undoubtedly familiar, when the pandemic struck our region, the resulting layoffs of workers across industries hit the region with huge unemployment rates. We saw an unemployment rate in April of 11.6%, up from 3.4% in March. Of course, immigrants and refugee clients in the International Institute were also highly affected from these massive shifts in the labor market, and the words unemployment benefits entered many clients' vocabularies for perhaps the first time ever. But unlike the native-born populations who, although faced challenges of navigating layoffs and unemployment, the challenges faced by our new American clients to access these unemployment benefits were very widespread. Accessing unemployment required an individual to enter a database and create a username and password and navigate this online portal, which was beyond the digital literacy abilities or technological capabilities for most of our clients seeking this service. If an individual was able to navigate the online portal, the information was presented in English, and despite hours and hours of being on hold to call in to receive support and questions, clients were often not able to access language support through the support lines as was listed. So beyond simply accessing the applications or the unemployment portals, the challenge to actually understand what benefits were available and to whom continued to shift during this period as the state and country rolled out new programs. Many of these programs were referred to, as I'm sure you've heard, by their acronyms. So the PUA, or the Pandemic Unemployment Assistance, which expanded the eligibility for those who were able to receive unemployment type relief, FPUC, or the Federal Pandemic Unemployment Compensation, PEUC, or the Pandemic Emergency Unemployment Compensation, and more. So these various acronyms and expanding eligibility and the rollout, therefore, were adjusted and began and ended over various parts of the last 8 months, which meant that individuals may have been interested to enter a program or thought a program was available to them that has since ended or they were no longer eligible for. We also started to see misinformation beginning to spread through various communities as individuals encouraged family and friends to apply for assistance, even if not eligible, particularly when the additional FPUC or the additional $600 weekly for those that received unemployment benefits was enacted. So combating this misinformation to ensure that individuals were not inadvertently providing fraudulent information became a challenge as other individuals besides our team assisted our clients with applying for benefits. Okay, so I already changed the next slide. That's okay, you can go back, please. So in order to address these challenges and the needs of our clients during this troubling time, the Workforce Solutions team jumped in to immerse ourselves in this new world of unemployment benefits and eligibility. Our team was often learning on a day-to-day basis, much like the rest of you and the rest of the country, on what the requirements, benefits, eligibility, and options a client may have when laid off. This meant that we had to look at each individual case on an individual basis to ensure that we were assisting with the correct and appropriately identifying the appropriate program for that person's situation, and then navigating the required information and documentation from the client or to the employer to ensure the status and eligibility was completed correctly, or following up with the appropriate department to ensure the application issue was resolved. So from light touch, in answering questions or helping folks to connect assistance to full application and follow-up, our teams assisted over 190 individuals to this point of this year so far with unemployment. Many individuals had not accessed services the employment services or other services to the International Institute in many years, or had been working consistently into this point. And so they just really weren't certain where to turn. And we made sure that we tried to spread the word that we were available to help navigate that as best as possible. So once applications were completed and approved, individuals, of course, had to complete weekly requests for payment in order to receive their regular assistance payments. So without access to computers and tech support that might be needed to navigate this alone, many required this assistance to maintain these benefits through regular calls and check-ins with our team. After job search activities resumed as a requirement to maintain benefits, the documentation and requirements for this action required assistance as well. So early on, we also saw identification verification and immigration status verification required for applicants for this. And often applicants were asked to mail or email copies of their ID cards to the appropriate office. So our team worked to find secure and encrypted ways to gather this information from our clients and to make sure that it got sent or presented to the unemployment office as securely as possible. Again, the technology required to be able to perform these actions was beyond the scope of many folks to navigate on their own. So our team did maintain a tracking list of individuals served to be able to help follow up with any needed additional services or follow-ups that may be required for them to maintain or gain benefits. So, and we of course encourage clients to reach out with any other concerns or questions as well. So despite the huge numbers of layoffs, some clients were recalled quickly back to their jobs after being laid off, and others also just decided to seek unemployment at this time. There were also those who unfortunately didn't qualify for even the expanded unemployment benefits, such as PUA, and had to seek jobs, maybe their first job ever in the US during this time, such as the newly arrived refugees that Anita had mentioned, Ariel had mentioned. So fortunately, with our strong and new employer partnerships, we were still able to connect individuals to employment opportunities during this period, despite the preparation and employment interview practice looking a little differently than it had when we were able to provide these services in person. So we did continue, and we will continue to connect folks to employment opportunities as well that would also meet the needs and the comfortability level of the participants during this time, because we do know that obviously individuals have different preferences and different situations in terms of working outside of the home. So all in all, our team worked to meet individuals where they were and provide the most up-to-date information and services to meet their needs at that time. Of course, that changes and will continue to change. We will continue to pivot and learn as the unemployment processes change or are extended after December, and we'll continue to update our clients on their options. So that's a bit about how we navigated our unemployment and employment needs of the clients. And now I'm going to turn this over to my colleague, Rosie Lang, to further explain the ways we were able to communicate with our clients during the pandemic.
Thank you so much, Chelsea. My work with the agency has really been twofold. In one part, directing social work services, and then in another part, working with the agency's COVID response team more broadly. So today I'll be focusing very briefly on some of our crisis communications that arose in response to the pandemic. Now, if you can remember at the beginning of the pandemic, how much information we were all consuming and how much was coming out and how some of that information was very much conflicting, right? Well, we recognized very quickly, of course, that our immigrant and refugee populations did not have the same level of access due to language, and more importantly, access to quality, accurate information, right? There was so much out in the community floating around, but it wasn't accurate and at times led to some unsafe behaviors. So we asked ourselves how to most efficiently and effectively disseminate information to our clients en masse quickly as a supplement and not a replacement for the absolutely wonderful work that our staff rather have been doing one-on-one to support and communicate to clients. So again, a supplement, not a replacement. And we opted to utilize a broadcast call system that we had typically used as an emergency response system for staff, inclement weather, things of that nature, and repurposing that system for the model we're using today. This essentially is a robocall system, but it's been enormously useful in communicating critical public health information to our clients. Now on the screen here, you see a few stats. I'm not going to read through all of them. They really take you through the month of September. We've actually pushed out a lot more since then, but just highlighting a few. We've got actually a fairly decent hit rate for these types of calls, averaging around 70%. And we've also posted recordings of some of the calls to our website in order to expand the reach of messaging. And this is something that in future months, I'm hoping is accessed a little bit more. In addition, we've hosted workshops through our Let's Talk About It series that have targeted Afghani and Congolese populations in particular, and posted those on YouTube to further support that messaging. So creating multiple avenues and multiple mechanisms to get information out. And then we also implemented for roughly a 6-month, 7-month period, 6 different language lines in languages that are most commonly spoken by our current newly arrived refugee populations. And these were lines where individuals could call indirectly and get connected very quickly to a worker, additional resources, get information, rather than going through a primary operator, which is a fine system in normal times. But given the urgency of the needs that we're presenting related to the pandemic, we really wanted to create very open access points to facilitate a speedy response time to those needs. Now, in the next slide, we're going to talk a little bit about some of the information in our programming. So if we could move to the next slide, or rather information on the types of calls that we were doing. So while we did include some information on programming and changes to our building accessibility in a few calls, we've tried to be really intentional about using the system predominantly to increase information to promote safety and security for our populations. And so, of course, we've covered everything from symptoms, wearing face coverings, physical distancing, things of that nature. But we also went into detail about the city and county orders, trying to really dissuade panic around those, and at times, and at the same time promote adherence and understanding of these fairly nuanced orders for our population, at least. We also included information around the protests and curfews that occurred over the summer, as that is of course a public health issue, and it's historically not been something well understood by our populations. And on top of that, it can actually be quite triggering for some of our populations as well to see protests in the community. We've posted information on stress, really trying to normalize and validate what many of us in the community are experiencing, as well as pointing individuals to how to seek care, how to get access to that care for any mental health concerns that may arise. And then finally, of course, we included information on local resources throughout the community, food programs, some of our giveaway events where we gave out basic need supplies and PPE, really so that people knew where to go, of course, and most importantly, understood that there were resources available and that they didn't have to be alone in this, and that help was available, and it was a community-wide effort. And I think it's important to note at this point that these communications have been a really significant undertaking, and we've really had to rely on a team approach. I cannot highlight enough how wonderful our team and staff have been in pitching in and assisting in these efforts, because it really does. It takes time, it takes coordination, from developing messaging that is simplified and takes into account linguistic and cultural considerations. Right now we're thinking about support bubbles and how to message around that and make it palatable for our populations. And it also takes very speedy turnaround from the individuals who are doing the recordings in the primary languages. And then, of course, a strong back end support on the technology side of things. And in the next slide, go to the next slide, it's a little bit of data on our calls to date, really, again, taking us only through September. So as you can see, calls began in March when things really started getting moving in terms of the pandemic and pandemic response in the St. Louis area. And while March looks fairly similar to April, it's important to remember that these calls began March 20th. So we were pushing out 5 calls at the end of March, which again required incredibly rapid response and would not have been possible without the mobilization of a very highly functioning team, cross-departmental, cross-agency. You see a decrease around June and July. This was in part due to less rapidly evolving critical information, less mandates, things like that. But also in addition, I think clients were starting to get more acclimated to remote services and communicating with workers remotely. The pandemic at this point, or at least how people were reacting to it or responding to it, really took on a different pace. In addition, in July, we resumed some very limited on-site appointments with a host of safety protocols in place around that and health screenings that supported client safety and worker safety. What we're likely to see, and we've already started to see in the past week, is an uptick in calls and communications going out. And we anticipate that this will continue for the next couple of months, as well as potentially into the next 2 quarters, thinking about vaccinations and how do we get information out about vaccinations as they become available and promote our populations getting the vaccine, right? So with that, I'm going to turn it over to Anita Barker, who oversees our education and training programs, and she is going to be talking about some of the innovations that they've been implementing in their work. Thank you.
Good afternoon, everyone. Thank you, Rosie. I'm going to give a little bit of context before I go into how we adjusted everything in response to the pandemic. And so the context I'm going to give is just the different education programs for, we do programs for adults as well as for youth, but I'll start with the adults, programs that were in session, in progress before the shutdown, or which were scheduled to happen in the spring. So those programs for the adults include English. We were offering English all morning, afternoon, evening, from literacy level to advanced. We were offering citizenship classes, different levels of classes geared to different levels of English, also morning, afternoon, and evening. And we were in a new session, a few weeks into a new session in February when just before the shutdown happened. Our Bridge to College program, and you can advance the slides, sorry. Our Bridge to College program is a program that helps students understand and practice academic reading and writing skills, and also the college application and admission system. That program had already been in progress when the shutdown happened. So it was beneficial to those students that they had a booklet. They had already met with their teacher several times for several weeks before the shutdown happened. So that was a relatively easy transition to the remote. We also offer job search training programs. Our STEP program is for refugees under 5 years in the United States, and it's a job search kind of program geared to students with lower level English to intermediate level. Our CAPE program, our Career Advancement for International Professionals program, is similar to the STEP, except that it is geared to the students with higher level English, advanced degrees. And then our Refugee Career Pathways program also has industry-specific vocational trainings. And it was in December that we ended our construction trades focused in training for VELT. We call it VELT. You can advance the slide, sorry. We also were planning to do a healthcare and an industry specific to a training specific to the industry of automotive trades, planning those to be scheduled sometime in the spring. In the next slide, you'll see that we also have services for youth, and it's an after-school program that we offer to immigrant students who attend St. Louis Public Schools High School, most of them at Roosevelt right around the corner. That was happening in person at the Institute on site. We also have a refugee youth mentoring program for refugees between the ages of 15 and 24. And that program was, we had plans, had already begun a new session, and the sessions include a one-on-one weekly with mentor and mentee meeting. And many of those meetings were happening on site at the Institute, as well as group events where we would take mentees and mentors to different places in St. Louis. There's a picture of all of us down at the Central Library downtown, but we also took them to college fairs prior to the shutdown, to college fairs, to university for campus tours and university sports activities. We also got to go to the aquarium, and then the shutdown happened. So all the plans for group events that were scheduled for March, April, and May through till now basically had to be put on hold. So how did we approach the delivery of educational services in a remote environment? What I like to say is, how did we try to keep the education lifelines going? The staff here chose to do two different types of models. One group of models were synchronous, live interactions at scheduled times with the students, and the other type of model was asynchronous. So these were pre-recorded lessons that were shared with the students that they could then watch it on their own time. In the next slide, I'm just going to show quickly how the synchronous programs, how the programs that did synchronous live interactions at set times, which programs did that. So our youth programs, our intermediate citizenship program, our Bridge to College program, and our career advancement for international professionals chose the synchronous model. And one thing to note about those students in those classes, a lot of them have higher level English, at least strong conversational skills, even though the after school students may have been lacking reading and writing skills and digital literacy. Their conversational skills were helpful. So we used Zoom, WhatsApp, Microsoft Teams, video chat, and the phone, a lot of use of the phone for communication in real time. And the advantages of this kind of synchronous training, of course, it's communication in real time, immediate check of comprehension and feedback from the teacher. And it also, I think that kind of engagement has helped break down the isolation that many of our clients have felt. The disadvantage, of course, is that the schedule, it's been really a struggle for our youth programs to meet and find a time that works for both the mentor and the mentee. Schedules of other family members, the amount of bandwidth in a house, if several of the children are also trying to do remote learning with their schools, trying to find a time when bandwidth is available and there's also some quiet in the household has been a challenge with this remote live interaction type of model. One thing I'll also point out is that our after school program, we were so fortunate, we were able to obtain Microsoft Teams education platform licenses, which is the same platform that is used by St. Louis Public Schools. So those students really needed that extra help to be able to interface and access any of the instruction they were getting from St. Louis Public Schools. So we felt this was a huge advantage to the way we delivered the youth program services. In the next slide, it's just a quick summary of the asynchronous classes and trainings we offered. And these were pre-recorded lessons basically that have been sent to students using text message or WhatsApp, and again, Microsoft Teams. This asynchronous model has been helpful for programs that we offer that are geared to students with lower level English. And the reason is they're able to watch the recording they receive, and these recordings are very short. They're able to watch those recordings multiple times, as many times as they need to really understand the video that's been recorded, or also to watch when a family member who speaks more English is available. So we have found that that's been a really nice advantage for some of those pre-recorded lessons that we've delivered. The next slide shows some of the key elements we've tried to ensure in each of our educational services. First, it's making sure that we can assess the client to determine if they're eligible for the service or not. As I mentioned, there are age constraints. There's also time in the United States constraints and status constraints for some of our programs. Also making sure that they receive materials in advance of the lesson. And at first we were doing this through mailings. We have found that even more effective is to give them in person, whether we drive paperwork or materials to the client's homes and meet with them outside their homes, or have them come to the Institute. In the picture, you see two of our staff members connected with our citizenship program, getting ready to receive. We have about 40 lower level students engaged with citizenship and almost 30 engaged with our intermediate citizenship. So those materials are picked up by the students at scheduled times and scheduled weeks within a session. We also have to make sure that they access phone and have access to a phone or virtual tools and understand how to use those virtual tools. And for that, it's been really important to have a one-on-one in-person kind of orientation, again, following safety protocols. The Institute is not allowing any clients on site now, effective this week, but prior to this week, we were able to meet with clients one-on-one in the computer lab, or as you see in the picture, out in the parking lot. That's basically how we adjusted. And I'm, again, to echo what everybody else has said, just amazed at the dedication of the many staff members who have worked to make remote access available for our clients. Thank you.
Okay, so with that, we will open it up to any questions that the attendees may have.
So thank you so much for the presentation. It was wonderful. We have 2 questions here. I'll go ahead and ask the first one. It's, so are the synchronous learning sessions in a group or individual format? I'm gonna answer that part first. There's more, but might be good to answer it in pieces.
Okay, so the synchronous lessons have been a group, so a video chat or a group getting together at the same scheduled time. For our CAPE program, for example, it's not a very big class, it's a small class, but they were able to meet on Zoom through Microsoft Teams. And then for our mock interview night, able to go into breakout rooms. We've done workshops for the youth that were also done on Zoom. And then the practice for a job interview happened in breakout rooms. I mean, it's been a learning experience for all of us, including the clients. But I'm just amazed at how everybody has stepped up, including the students that we work with.
Okay. And how do you feel that the public schools have responded to the needs of refugee immigrant students during the pandemic?
I feel for the public schools. It's been a challenge for everyone. And as you know, they were on spring break when the shutdown happened. And so all of this had to happen with very little time to prepare. I know that the St. Louis Public Schools sort of took an approach of holding students harmless or holding harmless. So grades did not suffer for students in the fourth quarter. I think a challenge has been getting tablets, getting whatever devices needed to the students. There were times when some students showed up at the Institute lost. They didn't know how to go to wherever they needed to go to get the devices. I just think it's been a really challenging time, and I just give a lot of credit to people that we work with at the St. Louis Public Schools, high schools, who have been, very responsive when we've reached out to try to troubleshoot the different access issues or digital literacy problems that some of the students have had.
Wow, like others, I'm so impressed with all your work. Did any families contract COVID, and did you need to help with medical appointments?
I can take this one. So with the spread being so wide in the community, we unfortunately, yes, have had clients who have contracted COVID. I think it's in some ways very fortunate that we've had a pretty robust case management team here that has been really instrumental in helping connect people to care. But just like everybody else, we did have to shift our case management model. In previous times, we would often be the ones taking clients to medical appointments and helping them navigate the medical system in person, on site, walking with them as they access care. And of course, that's no longer safe to do. So I think transportation is an ongoing issue. and had been even prior, for many of our clients. But I think that's one of the biggest pieces that we see. And so really helping clients connect with telehealth services, understand how to get testing, things of that nature have been our primary focus.
Do you have any programming available to clients who identify as undocumented, or another resource that may be helpful, especially during COVID?
We do have programs for individuals who identify as undocumented. They might be very limited. One of the key programs that we do have is we received CARES funds from the city of St. Louis to provide rental and mortgage assistance. And anybody who lives in the city who's behind in their rent or mortgage due to COVID, they have to have a COVID-related reason, is eligible for rental or mortgage assistance, regardless of their legal status in the United States. We have other programs that they're eligible for, usually once they obtain some status, whether it's an asylee status or another type of status that they will obtain.
I'll just add that for education, we don't, except for certain programs that are funded and have restrictions, for example, those trainings that I mentioned that are connected to our Refugee Career Pathways program. And of course, they have to be work authorized for the job search trainings. But for the after school program, for example, it's open to any immigrant who is enrolled in St. Louis Public School High School. So we are not checking immigration status for that, purpose.
We have a few more minutes for more questions. If any of the attendees want to put a question in the Q&A section, click below. Or if any of the presenters would like to share additional information that they didn't get the chance to share. Okay, we have another question. What do you feel will be most challenging about the upcoming months, and how can we prepare?
I think for my department, which is primarily refugee resettlement, we are anxiously waiting to see what and if there will be any changes to allow refugees to come to the United States in larger numbers. We're just all kind of sitting on pins and needles, waiting to see will there be executive orders, even with this current administration restricting immigration to the US, and then will there be additional executive orders with the new administration undoing what the old administration did? So we're kind of anxiously waiting for that. The good news is that in St. Louis, at least, we have a very diverse pipeline of immigrants and refugees wanting to come to St. Louis. So we have people from many nationalities and different parts of the world. So that keeps our pipeline very, very active. While I don't relish it, I would certainly welcome if all of a sudden we had an influx of refugees arriving to St. Louis in June or July or even sooner than that. We could gear up. We've met that challenge before, and I know St. Louis, the community will assist us and meet that challenge again. I did want to say that during COVID, our immigration department has continued to provide immigration services to clients, which is very, very, very difficult because it's all remote. And if you've ever done an immigration application, I mean, just the application alone could be 20 pages long, and that's not including any documents. So doing this remotely, either by phone or video calls, has been a challenge, and then also obtaining signatures. But we've been able to do this like other departments in the agency, and I'm sure other agencies, either having a drop-off type of situation where you would drop off a packet at the person's mailbox. You'd stand back, wait 10 minutes, wait for them to sign it. Then they'd go into their house. You'd pick up the packet, of course, with your gloves on and your hand sanitizer. So we've had to be very creative and novel in how we address things that we need to get done that need to continue happening for the benefit of immigrants.
And I can jump in too. I think, one of the things we're looking really closely at are the upcoming end to some of the benefits tied to FFCRA and some of the other programming that's been out there. And so we're going to be looking at how that's going to impact our immigrant and refugee families. I know for our work, we're also very worried about isolation. Pandemic fatigue is hitting our populations just like it's hitting all of the other populations in our community. And we also know that culturally speaking, for a lot of our groups, staying isolated is just something that is not the norm, and it's very difficult to engage in. And so worried about isolation, worried about risk for some of our more vulnerable populations, like the elderly in particular.
What are the clinics, hospitals where you see refugees going?
Our families utilize a wide range of resources. We have a lot of families going to our federally qualified health centers like Affinia. We also have clients who are still actively going through the BJC system, SLU, you name it, any of the major systems that we have here, our clients are accessing.
And do these services, do these great services reach only St. Louis County and City, or do they reach out to other cities as well?
What's the question? I'm sorry.
Do these great services, resources only reach St. Louis City or County, or do they reach other cities as well?
The Institute provides services to individuals in the city and county area based on their status in the United States. We do have an office in Springfield, Missouri that also provides refugee resettlement and employment services to refugees and immigrants in that area.
Would that be through you all, or is that through a separate office?
It's a separate office with a separate staff. They are an affiliate, if you will, of the International Institute. So they have all of our resources that we have here in St. Louis, but they've also designed and implemented their own resources specific to the Springfield area. What's very interesting about Springfield is about an hour away from Springfield is two different small rural towns that have large immigrant populations due to the slaughterhouses and factories that are out there.
And we have about 1 minute, so really quickly, have there been any silver linings that you've observed, things you've learned during the pandemic?
I can share a quick silver lining. I mean, as we've developed these trainings that are remote, these pre-recordings, just stretching skills for ourselves as well as our clients in accessing more information and practicing more information in remote ways. We've always had a struggle with people getting to the Institute at the set time that a class or a training was offered. So this maybe opens up the possibility to offer things in the future to those clients who might continue to be or need to be remote after the pandemic ends.
Great.
I would just like to say, we've always stressed the resilience or the so-called resilience of immigrants and refugees. And in this presentation, at least, we really talked a lot about how they were more comfortable and used to face-to-face interactions. However, they rose to the challenge just like we did. It may have taken 10 times to show them how to download an app so they could do video calls, but they got it. They eventually, and they started to embrace it and accept it just like we did also. So they really rose to the challenge, and I have to commend that. I know now, though, as Rosie had mentioned, many of them, just like us, are now facing that isolation and that just wherefore of not feeling good. So that is the next challenge, and I'm sure that they will most probably teach us as much as we teach them.